student identified with dyslexia can receive dyslexia services via IDEA, which stands for Individuals with Disability Education Act under Special Education, or via Section 504. How is the service model determined? We will explain how in today's session. A student with dyslexia has a disability under IDEA if the student meets the criteria for a specific learning disability and, because of dyslexia, needs special education. There are specific responsibilities relating to providing special education services, such as providing an individualized education plan, or IEP for short. The IEP must include appropriate reading instruction and specially designed instruction. The manifestation of dyslexia exists on a continuum from mild to severe. Likewise, DISD offers instructional models on a continuum to meet each child's needs. Typically, standard protocol dyslexia instruction is effective for students with few cognitive weaknesses, or their combination of cognitive weaknesses does not significantly impact their learning across all subjects. These students may also have other disability conditions and some weaknesses in executive functioning, skills such as attention, organizing, starting tasks and staying focused until completion, self-control, or self-monitoring. The combination of factors influencing their unique learner profile does not significantly compromise their response to standard protocol dyslexia instruction. For these students, progress in grade-level curriculum is more evident with tailored accommodations. A different dyslexia instructional model, called specially designed instruction, may be necessary for students with a combination of cognitive weaknesses and/or other disability conditions that manifest with a more significant impact on learning. More impairment in executive functioning may present in their learner profile. These students often have a slower rate of response to the interventions and have trouble retaining what they have learned in reading and spelling. Since their rate of response does significantly compromise their response to interventions, progress may not always be evident on standard grade level measures. These students will often need an IEP with modifications to help them access grade level curriculum and specific accommodations. Both standard protocol dyslexia instruction and specially designed instruction have many similarities. They have 8 components of instruction which must include phonological awareness, sound symbol association, syllabication, orthography, morphology, syntax, reading comprehension, and reading fluency. The delivery of the instruction must include these 6 approaches: be simultaneous and multisensory, be systematic and cumulative, be explicit, be diagnostic teaching to automaticity, be synthetic, and be analytic. Dyslexia instruction must be evidence-based and effective for students with dyslexia, taught by an appropriately trained instructor, and implemented with fidelity. This instruction is designed for all students with dyslexia and will often take place in a small group setting. It is a pull-out direct instruction for students in kindergarten through 6th grade. For students in 7th through 12th grade, it is a scheduled class. Specially designed instruction differs from standard protocol dyslexia instruction in that it offers a more individualized program specifically designed to meet a student's unique needs. Additionally, it could take place in a special education setting. RISE is Restructured and Individualized Special Education. It is available for students in 5th grade through 12th grade whose needs may be more appropriately met through RISE, where the dyslexia instructional components of critical need will be implemented. All teachers providing dyslexia instruction have been trained in a program that follows an Orton-Gillingham curriculum. Nijhuis's Basic Language Skills curriculum for English speakers and Valley Speech's Esperanza curriculum for Spanish speakers are used to implement standard protocol instruction and specially designed instruction. Region 4's Reading by Design is used to implement the components in the student's critical area of need for dyslexic students in RISE classrooms. If the student does not have a specific learning disability, they may still have characteristics of dyslexia that substantially limit one or more of life's major activities, such as a specific activity of reading, so the student can receive support through Section 504. The Section 504 plan could include reading instruction as appropriate to meet the individual needs of the student, as well as any necessary accommodations and/or related services for the provision of FAPE, a free and appropriate public education. Students under 504 that need dyslexia instruction will receive standard protocol instruction. Instructional decisions for a student with dyslexia are thoughtfully made by either the ARD committee under IDEA or the 504 committee under Section 504. In order to make an informed determination, each committee must include certain required members. These required members must include, but are not limited to, members who are knowledgeable about the student being assessed, the evaluation instruments being used, and the interpretation of the data being collected. Additionally, the committee members should have knowledge regarding the reading process, dyslexia and related disorders, dyslexia instruction, and district, state, and federal guidelines for evaluation. For English learners, a member of the LPAC committee must be part of either the Section 504 or ARD committee. Lastly, IDEA requires parent participation in the process. While not required under Section 504, it is suggested that the parents, guardians of the student be a part of the identification and placement process. Together, this qualified team will review all data to make informed decisions about what is best for each student. Feel free to contact us with any questions or for any additional information.